Hi there, I'm Kristen, and I'm going to be talking a little bit about personal protective equipment. This is all really important in the healthcare field because we need to make sure we stop infection, and so the order in which we do everything is important. Also, understanding the way and the mode of transmission that occurs with different types of illnesses, and then therefore taking the proper PPE to protect ourselves and to protect other patients and staff is very important. So as I mentioned, the sequence is imperative, and when we are in the hospital setting, there is a sequence in which we put things on. We're going to go gown, mask, goggles, and gloves, and there's, essentially your gloves are the dirtiest, so those are going to go on last. Obviously, you have to wash your hands before everything. And then I'm going to go ahead and just demonstrate that right now. Okay, so I've come in the room, if this is the instance or the circumstance, and basically I've already washed my hands, and I'm going to go ahead and put on this gown. Sometimes they have the little thumb, which I really like because it makes sure it really helps to make sure the gloves go over the top of it. So I'll secure this in the back. This is something that someone else can do for you. Now, when donning in the room, it's important to remember that if it is an airborne precaution, obviously before entering the room, you're going to want to have your N95 mask. But I'm just showing you this right now because this is all very basic. So first I've done the gown, okay, and being careful not to touch anything else. And then next I'm going to go ahead and put the mask on. And this is just an ordinary mask, okay? This does not protect me against any type of airborne transmission, but it will protect me against droplets. And then I just cinch right here, okay? And then after that, I'm going to put on my goggles if necessary. Goggles are typically just worn in circumstances where there may be droplets that could become transmissible, or, whatever, if someone had influenza, etc. So I'll put these on next, and these go on in this order because they go just right over my my mask. And then now lastly, I'm going to put on my gloves. Now these are just regular gloves. They're not sterile gloves unless I was doing a sterile procedure. And so I would discard that because I dropped it, and let's just pretend I'm getting a new one. Okay, and there's a different way for donning sterile gloves, but for these, we just can go like this and have it go over the jacket or the gown. That way none of my skin is being exposed in case this is a contact precaution. And we'll go over each precaution and when and what you would do. So for removing everything, now what's dirtiest is my hands. So I'm going to want to go ahead and remove my gloves first. Okay? And then touching just the inside. Now, this is the inside of the glove here. Now, if there's bodily fluids, it's going to go in the biohazard. Otherwise, just a regular trash can is fine. Okay, after that, I'm going to remove my goggles. Okay, and these are also can be thrown away. Next, I'm going to remove my gown. Okay, and so I can just go ahead and break away, which I'm not going to do because I actually need to keep this. But let's just pretend that I broke it away. And so I'm going to want to come around, coming in on the inside of the gown, coming down, and then here on the inside of the gown. So I've never touched the outside of the gown. I'm going to discard this, okay? Now at this point, if, I am wearing a mask and I do feel like there's stuff going on in the air, it's airborne, I have an N95 or just a regular mask, I can go ahead and wash my hands, okay? And then I can take this and loop and pull. Now I have touched my face again, so I would want to wash my hands once more. But again, for donning, it goes gloves, mask, excuse me. For donning, it goes gown, mask, goggles, gloves. And for doffing or removing, it goes gloves, goggles, gown, mask. So let's go over some of the different precautions that we have and what the normal and standard not standard, but the universal precautions are for each type of illness and some of the different types of common illnesses that exist within them. So first of all, I start with airborne because airborne is a special room set up for someone who, for example, might have tuberculosis. An airborne room could also be for someone who's immunocompromised. So that might be a negative pressure room for a chemotherapy patient. It could be for someone who has chickenpox or measles, but not if the chickenpox or the lesions are crusted over. Once they're crusted over, it's no longer airborne. If you're kind of unsure, we're probably just going to stay with airborne because it's one of the safer precautions, especially if you're donning gloves, doing the gown, and having a mask. Disseminated is the herpes zoster, and that's pretty much about it, but mainly TB. That's what we're going to see a lot of. And in this particular type of scenario, you do need the N95 mask, which is, well, I don't have one on me, but it is very specifically, it wasn't in my package. It's very specifically fitted to your face and then tested to make sure that nothing airborne can come in. And this is something that needs to be routinely checked as a nurse or a healthcare professional who might be dealing with TB patients once a year. So you have to be refitted in case you've gained or lost weight, etc. The other thing that you need is potentially goggles and potentially gloves and potentially a gown. But the main thing that you need for airborne precautions are the N95 mask. That's really what's going on with that. And I'm sure that kind of makes sense as it is. But the goggles, the gloves, and the gown can come in handy as well, especially if there's other things going on that we're not sure about. Okay, the next type of precaution is a contact precaution. Now, this precaution is really good and typically gets placed on a room where we're not sure if the patient might have, some sort of, what's a good, if we're not sure yet if this patient has C. diff, maybe they've had it in the past, we're not sure if they have it now, they have loose stools, we'll probably put them on contact precaution. Okay, presence of stools or incontinence, maybe that draining wounds, norovirus and rotavirus, any type of secretions, any pressure ulcers, not necessarily because you're afraid you're going to get something from them, but also to keep them protected as well, right? So we want everything to be very clean. It's not quite a sterile technique, but it's clean stuff, and we've got the gown, we've got the gloves on. Anything that you're unsure of, ostomies, rashes, etc., anything where you're like, hey, this might be transmissible through contact, you're just going to go ahead and you're going to put on the gown and then you're going to put on the gloves. Okay, and then the gloves are definitely mandatory for this, and the gown is mandatory for this as well. The mask and the goggles are not, but they can be used if you feel like this is a scenario where you may need them. The next precaution to consider is droplet precaution. Okay, so I always think of droplets, but people sneezing and the flu. So this one's pretty commonly seen with patients that come in where we suspect they might have the flu. RSV, which is a respiratory problem, also any type of other respiratory problem where you're hacking or coughing, etc. When you're within 3 feet of the patient, that's really where you're really needing to think about these droplet precautions. Also pertussis, group A streptococci within the first 24 hours of not being treated, and Neisseria meningitis within the first 24 hours. After 24 hours of having this type of meningitis and this type of strep throat, strep A, and Neisseria meningitis, and you are on antibiotics or under treatment, within 24 hours, you don't need to be considered or treating as a droplet precaution. Anytime you're not sure, you always just stick with the protocol or do whatever you feel is safe. Never going to get in trouble for using extra PPE. I mean, that's you protecting yourself. So that kind of covers all the different circumstances in which we would use droplet. Now, what you need for droplet are certainly a mask, but it can just be an ordinary mask like this one, okay? If you also would want to have gloves and a gown and a goggles and a face shield, if you felt that there might be any bodily secretions. Because if someone, for example, coughs and there's a microscopic droplet that you cannot see and it lands in your eye, that is a portal of entry. So if you're within 3 feet of a patient who is having these secretions, etc., it's definitely recommended that in addition to the mask, you're wearing the gloves, the gowns, the goggles, the face shield. And so that pretty much covers the different circumstances that we're dealing with our precautions. Go ahead and say, just because it's sticking in my long-term memory now when I say this, but for donning, you want the gown, mask, goggles, gloves, and for doffing, the gloves, goggles, gown, mask. And that order is important to remember. And if you add extra things, that doesn't necessarily change the order. It just puts different things in different orders. For example, you put on your feet shields, etc. So that concludes the PPE video. Again, I apologize. It wasn't working before, and you were correct. It was a glitch on my end with actually my software. So I went to Apple and I got everything figured out. So hopefully I'll check it out. Make sure you can hear the video all right. But yeah, thanks for listening. Okay.